situation at Limerick University Hospital has been in crisis for some time. There is huge concern regarding the accessibility to the hospital, the level and quality of care and the threat to patient safety. The Department of Health has appointed an expert team to investigate the chronic overcrowding and the apparent breakdown in the delivery of services. Despite the fact that UHL gained an additional 100 beds over the past 18 months, last Thursday the hospital recorded 126 people on trolleys, the highest figure ever recorded since records began. These patients were not in A&E. They had been triaged and deemed to be in need of urgent admission. What are the terms of reference for this expert team? Will they engage with the nursing staff, the GPs of the region, the ambulance services? Will they engage with and listen to the traumatic experiences of patients? It is imperative that they examine and indicate the additional supports and facilities that should be provided at Nina, Ennis and St John's Hospital to alleviate pressure on UHL. And I would ask, would they examine also the need for step-down beds? And Taoiseach, in the interest of transparency, the outcome of this inquiry should be made public.
Thank you, Deputy. Taoiseach.
The Minister for Health did write to the HSE CEO on the 26th of April, Deputy, to request that an expert team be sent to UHL to ascertain urgently what additional resources might be deployed, as well as any changes that could be made quickly to alleviate the current pressures being experienced in the emergency department. And that expert team began their assessment at UHL last week. A key part of the solution for Limerick is additional beds. As you said, 150 additional beds have been opened in the UL Hospital Group since the 1st of January 2020. 98 of these have been in UHL. The hospital has reported they are continuing to deal with record volumes of patients attending the emergency department. It recorded a 10% increase in attendances in the first quarter of this year as compared to the same time frame in 2019. The hospital is working to ensure that care is prioritised for the sickest patients, and as part of the escalation plan, additional ward rounds, accelerated discharges and identification of patients who transfer to UL Model 2 hospitals are all underway. UHL is working with HSE Midwest Community Healthcare to formalise a governance structure to deliver on the investment in community care, hospital avoidance, chronic disease management and older persons, and has further plans for Limerick, including the provision of a 96-bed ward block at UHL. The award of a works contract was approved by the HSE board on the 25th of March of this year.
Deputy.